is a neurodegenerative disease that is ultimately fatal. As we can see here, on the left is a healthy brain section, and on the right is a brain section from a patient with Huntington's. The brain matter is significantly reduced. Although Huntington's is an autosomal dominant disease, and we know the mutant gene and the protein, mutant huntingtin, that cause it, surprisingly, there are no treatments available that cure or even slow the progression of the disease. In the paper, Sustained Therapeutic Reversal of Huntington's Disease by Transient Repression of Huntingtin Synthesis, Kordasiewicz and her lab explore a method that could possibly become a treatment to slow the progression of Huntington's. Kordasiewicz and her lab use these specific antisense oligonucleotides, or ASOs, to help degrade the Huntingtin mRNA. When ASOs were injected into the cerebral spinal fluid of mutant mice that were engineered to have Huntington's disease, they exhibited slow disease progression and sustained reversal of the disease symptoms, even for a while after mutant Huntington had returned to previous levels. Figure 3, as we can see here, and we will look at in detail, depicts the effect of ASO treatment on YAC128 mice, a specific breed of mutants that exhibit Huntington's disease. Specifically, Figure 3 shows how treatment with ASOs reduced the amount of human Huntingtin protein in the brains of YAC128 mice and improved their motor coordination, which is normally impaired in mice and people with Huntington's disease. Both parts A and D of Figure 3 illustrate experimental design. A and D are the same, except that the experiment depicted in A starts when the mice is 3 months old, whereas the experiment depicted in D starts when the mice are 6 months old. First, before treatment, all the mice were given a baseline Rotarod test to test their starting motor coordination. A Rotarod test is a test that measures how long a rodent can stay on a rotating rod before falling. Rodents naturally want to avoid falling to the ground, and the length of time a rodent stays on the rod is a measure of their balance and coordination. As shown in Figure B, at 3 months, the non-mutant mice without Huntington's disease stayed longer on the rod than the mutant mice with Huntington's disease, as expected. Note that the group of mutant mice with Huntington's disease that would later be treated with saline was at this point identical to the group that would later be treated with ASOs, as they should be. Also seen in Figure B is that at 3 months, ASOs, which target human Huntingtin, or saline as a control, were infused into the left ventricle of the mice for 2 weeks. The mice were then given 2 more Rotarod tests. At 4 months, the ASOs treated mutant mice stayed with the Rotarod for longer than before and for longer than the control mutant mice, but not as long as the non-mutant mice. However, at 5 months, the ASOs treated mutant mice stayed on the rod for much longer than the control mutant mice and as long as the non-mutant control mice. 6 weeks after treatment was stopped, ASOs treated and non-treated mutant mice were tested using Western blots for levels of human Huntingtin protein in their brains. As you can tell, the ASO-treated mutant mice brains contain far less Huntingtin protein than that of the untreated mutant mice brains. A similar experiment was then conducted, as shown here in Figure D, but the experiment was started and the mice were treated with ASOs when they were 6 months old instead of 3 months. Rotarod tests were performed at 6, 7, 8, and 9 months. Similar but less dramatic results were observed compared to mice treated starting at 3 months in the previous experiment. As we can see here, The time before falling, a measure of motor coordination, was always longer for the ASOs treated mutant mice than the untreated mutant mice. However, the ASO treated mutant mice improved their motor coordination only slightly from 6 to 7 months and 8 to 9 months, and none at all between 7 and 8 months. Unlike in the previous experiment, the ASO treated mutant mice's coordination never reached that of the non mutant mice, even after 9 months. After 9 months, levels of human huntingtin were measured in the brains of the untreated and ASO-treated mutant mice, as in the previous experiment. The treated mice brains had far less human huntingtin than that of the untreated mice. However, they also had significantly more than the treated mice from the previous experiment that were treated at 3 months. Several conclusions can be drawn from these results. 1. The level of human huntingtin protein in a mouse's brain can be effectively reduced by use of specific ASOs, antisense oligomers. The treated mice brains had significantly lower levels of human huntingtin protein than the saline control. Second, treatment with ASOs can improve motor deficits in these mice, one of the functions that is impaired in mice and humans with Huntington disease. Treated mice consistently stayed on the road longer before falling off. Although only the improvements in the rod test was shown in Figure 3, improvements in other motor and behavioral tests were described elsewhere in the paper. Third, treatment of mutant mice with Huntington disease is more effective when started at a younger age. Treatment starting at 3 months, as in the first experiment, was more effective than 6 months, as in the second experiment. The mice treated earlier at 3 months ended up with less human huntingtin in their brains and better motor coordination than the mice treated later at 6 months. So the described experiments and others presented in the paper suggest that ASOs, or a similar agent, could one day act as an effective treatment for Huntington's disease in humans. Kordasiewicz and her lab have already tested ASOs in rhesus monkeys, which was shown to lower huntingtin protein in many brain regions involved in Huntington's disease. While much testing is still required, I believe that ASOs or similar approach will eventually be used to treat patients with Huntington's disease.